So you have pain in your groin, you keep calling it the psoas pain, but it probably is not necessarily psoas. So this video is just for you, very specific, but just for you. Hey, I'm Dr. Shaki from Irvine Spinal Wellness Center, your Irvine Chiropractic and Posture Clinic. So watch this. All right, so I get a lot of people coming in and saying, oh, my psoas is too tight. And your psoas is not the only hip flexor. So I want to bring to your attention one thing that is huge. And you could probably do this yourself. So with your hip flexors, your quad is a hip flexor. Your psoas is a hip flexor. Your iliacus is a hip flexor. You guys should look this up on, just Google it so you can see. So while your psoas, which comes from the front of your lumbar and it crosses over to the pelvis, causing hip flexion, right next to it is the attachment for the quad. And I mean, there are too many things to consider. So when you go lay down on the table, can you see this? If you lay down on the table, you grab the knee and you go back. I need to be at the edge here and let this thing stretch. That doesn't do anything. That's not how you stretch the hip flexors. The way you want to stretch the hip flexors is authentically, is a 6-month pose, baby pose, which is a concept of developmental kinesiology, DNS. But I just wanted to make sure you understand that the psoas is not your only hip flexors. I can't say it's overrated. It's pretty much compromised in everyone that sits for an extended length of time. But that one stretching I just showed you is just not gonna cut it. And psoas is one of a few of your hip flexors. So when your hip flexors are compromised, when you're standing up, what they do is they actually bring your torso closer forward. So if your torso is closer forward, because that's the same thing as flexion, two things are gonna happen. Either you're gonna go into this or you're gonna go into that, which actually extends it. So it's just a state of restlessness between extension and flexion of the pelvis, which technically, if you alternate between flexion and extension, chances are your hip flexors, not just psoas, have been overly active for so long that it's almost like, oh, I'm so tired. It's like as if that's happening. Anyway, I thought this is worth doing a video on. I hope you found the information valuable. I think that it's important to understand what happens so we can strategically address the issue. If you have not subscribed to the channel, this is your opportunity to do so. And if you have any questions, just shoot me an email. Until next time, take care.